work from the PowerPoint. And I'll get the door closed and we'll get going. So today we're going to talk about a treatment for moral injury syndrome called building spiritual strength. And some of you know me, some people who are logged on have no idea who I am. I am Irene Harris. I'm a psychologist here at the VA Maine healthcare system, affiliate professor at the University of Maine. I have been doing work in psych of religion and spirituality since back in the time when you said, I study psych of religion and spirituality. People went, you study what? You call that a practice of science? Things have gotten better. I'm actually at over 70 publications right now. The point is, I'm an old lady and I have been doing this a while. I am a VA employee. If I say something stupid, the VA does not take responsibility for that. If I'm stupid on my own. And we will start with a case study. So Robert, of course, we've altered demographics, etc. Robert came to talk to me wanting into the very first pilot study of building spiritual strength. He had had treatment for PTSD. He had done well. Most of his PTSD symptoms were resolved, but he had this lingering sort of loss of meaning and purpose that resulted in a depression that wasn't being resolved with medications or psychotherapy. He was still struggling with suicidal ideation. Now, to be fair to Robert, when I asked him at his intake, are you having any thoughts of suicide? He's thought once in a while, but I have kids. I would never do that to kids. Never, no, not going to happen. 3 years later, I was presenting at a conference with Robert's wife, and in the entire conference, she told folks, before he started building spiritual strength, every day I would, after work, go to school, pick up the kids, drive home, tell the children, I want you to stay in the car just a minute. I'll be right back to get you. Go in the house to make sure that daddy wasn't dead, and then come get the children. His suicide ideation was much more involved than he was reporting to me. Word had gotten through the grapevine that if you were actively suicidal, you wouldn't go in an experimental study. We don't do experimental studies on people who are suicidal unless they're experimental studies on better treatments to help them not be suicidal anymore. He did what he needed to do to get into the study. I found out later. Robert had a sense that he was, hi there. Robert had this strong sense of being unforgivable. His PTSD had cost him his military career. He thought that by leaving his unit, he had failed in a mission that God had given him, and that made him unforgivable, unredeemable. He used those kinds of words to describe himself repeatedly. Another area in which he was experiencing a lot of spiritual distress is he had an ex-wife, and he felt that he had not forgiven her. So he had these two areas that he really was not able to resolve in conventional PTSD therapy. Things got different for him very quickly in the Building Spiritual Strength protocol. The second session of Building Spiritual Strength, people work on communication with a higher power, and they work with it in the group, looking at all of the group members' different perspectives. In that session, his higher power concept, he was independent evangelical, so you might hear me use God for his higher power construct. I don't use that for everybody's. But in his world, God was a disappointed drill sergeant. He had not finished the task the drill sergeant had assigned to him, and therefore he could never earn back that drill sergeant's favor again. When he worked with the group, the concepts of higher power that came back to him, that were reflected to him, were that of a doting parent that was all excited to see who Robert was going to become. There was this sense of, Robert has been in devout service for this period of time doing these tasks, and he's learned these skills, and he's got these virtues, like this level of self-discipline and strength and this level of commitment to his family. He's going to take this stuff and he's going to do something awesome. And the group gave him a picture of a higher power that just not only loved him, but was just super excited to be in relationship with him, to see who he was, to see who he was becoming. And he told me that day the suicidal ideation stopped. And in long-term follow-up, he says it's never come back again. So the second issue that Robert really needed help with was this issue of forgiveness with the ex-spouse. He felt that he had not forgiven her because they were not reconciled. What was going on was that she had a relationship with methamphetamine that was really making it impossible for her to be in any kind of relationship with him. When we talked about what he was doing in that relationship, we found out that he was paying more than the required alimony for her because he wanted her to have a decent place to live, and he wanted their shared children to have a decent place to live. He was doing everything in his power to get her addiction treatment. She was not joining in the addiction treatment, but he was doing everything he could to take care of her. He was often buying the family extra things, etc., to take care of them. And the feedback he got from the group and the leaders is, that is forgiveness. You are doing absolutely nothing to take revenge for somebody who has deeply hurt you, and you are actually doing everything in your power to make their lives better. That truly is forgiveness. You are confused about what is forgiveness and what is reconciliation. It takes two people to reconcile. You can't do that by yourself, and she can't do that in her current condition. But you've done the forgiving thing. And his language to me at that point was, the rest of the shackles fell. He felt that at that point he was free. He could figure out what he wanted to do to be of service the rest of his life. He had the energy to fulfill it. He had the energy to be fully there for his family, etc., etc. So for at least Robert, things changed dramatically in building spiritual strength. In fact, so much so that the way Robert decided he wanted to be of service in the future was to go to graduate school to get a degree that would get him licensed as a mental health provider. He now works in a large urban area in a private practice that primarily serves veterans who would rather process PTSD and moral injury with a veteran who's walked that road. So the conditions that we try to treat using building spiritual strength are post-traumatic stress disorder and moral injury syndrome, which we'll talk a little bit about. That is the accepted language that's entrenched in the literature. It might not be the best language to use with clients. I will talk briefly about post-traumatic stress disorder because I believe that most people here are VA employees and are swimming in post-traumatic stress disorder all day, but we may have people online who are less familiar, so I won't just skip it. So there are 5 core requirements for a diagnosis of PTSD. One is exposure to some kind of trauma. Later, we'll discriminate what trauma is versus what a potentially morally injurious event is, but the take-home message is trauma is a threat that causes fear. Moral injury is an event that causes moral questioning. Intrusion symptoms, nightmares, flashbacks, finding yourself thinking about the trauma when you don't want to be thinking about the trauma and when you've got better things to do than be thinking about the trauma. Persistent avoidance, and I have a little star on that because one, it's underassessed, but two, this is the disabling symptom of PTSD. I have worked with lots of clients who have functioned as chief financial officers, CEOs, doctors, etc., very high functioning folks who have had PTSD, but they refuse to avoid. No matter how miserable it might be to get to work, no matter how many flashbacks they got to fight through to get the work done, no matter what their feelings are, they are still going to go home and engage with their family instead of hide in the basement with video games and beer. They make it, they function, they get through treatment, they benefit from treatment. On the other hand, when somebody's life becomes hiding in the basement with a pile of video games and beer, which all act as emotional anesthetic, those folks don't do well. Things generally get worse and worse for them. So I try to attack the avoidance first when I'm entering treatment. And when you read the manuals for PE and CPT, they use the same strategies. We're going to start exposure right away. You can handle it. We are going to do it. Negative thoughts and feelings, and this is often the cluster where we see the overlap in symptoms with moral injury syndrome. Very often it's, I am a bad person, the world is a dangerous place, etc., etc. And then hyperarousal and reactivity. My autonomic arousal goes 0 to 100 and nothing flat, like a good sports car, only it's nowhere near as fun as going 0 to 100 in a sports car. It physically hurts. Difficulty sleeping, difficulty getting to sleep, having nightmares in the middle of the night, waking up, not being able to get back to sleep, those kinds of issues. So I'm sure that's familiar to everybody who's in the room. There are subtypes of PTSD. Does anyone know the difference between type 1 and type 2 trauma?
Are we talking about like big T, little t, like the chronic versus like one major event or a series of major events?
Precisely. Type 1 is one awful thing happens. Type 2 is something happens over and over and over again. Prognosis is better for type 1. Combat trauma is usually which type?
Maybe both, like repeated exposure. Yeah.
It's usually type 2. If you're in direct combat. Now, military trauma can be either type, but if you're in a combat unit, usually there's a, hey, we're under attack, and then we're not under attack, and then we're under attack again, and then we're not under attack. So in that time, these are usually young adults. They are before age 25. Their brains are not fully mature, so they are extremely plastic. And then those brains wire because they know I got to use this emergency response system all the freaking time, and my life depends on it. So any spare energy, nutrients, glucose, etc., goes into the emergency response symptoms, which is how you get the hyperarousal. Childhood trauma. Similarly, we're looking at very plastic brains. So the nice thing is, like type 1 childhood trauma, prognosis is pretty good because we've got a really plastic brain that'll recover really quickly. Type 2 childhood trauma, on the other hand, the prognosis gets really ugly really fast because those brains wire so tightly into the emergency response system. This is really important working with veterans because in the all-volunteer military, does anybody know what the rate of adverse childhood experiences is before signing up with the all-volunteer military?
It's really high, much higher than the normal population, I remember.
40%. So, I mean, odds are really good that veterans who are sent to combat may have had PTSD or at least substantial trauma exposure before they ever went to combat. So that's something for us to think about. Sexual trauma I bring up because For many sexual traumas, one of the trauma cues that causes re-experience symptoms is close relationships. What do we use in therapy as a healing tool? Close relationships. The research on people with interpersonal traumas and spiritual functioning and spiritual distress says that it takes them actually a lot longer to benefit from even spiritually integrated care, because the relationship with a higher power is a close relationship. And so it takes these folks a longer time to begin to trust a higher power. That's not to say don't use spiritual interventions with that population. That's sort of like saying don't use therapeutic relationships with that population. But you do need to be aware that these folks need a longer time to be able to engage in therapy and to be able to develop the kind of trust that we need to benefit from therapy. And finally, military sexual trauma I bring up because people who don't work with veterans all day, every day, often think of military sexual trauma as being something like stranger rape and expect that that's how the recovery is going to go. It is much more like incest. The members of a military unit are interdependent with one another. So one example I like to use to help people understand how complex this is let's say I'm in the Navy, I am serving on a ship. There is one physician on the ship, and he sexually assaults me. Now, if I report that, where do I get my medical care for the remainder of this voyage? Furthermore, if I report that and our chief medical officer is found guilty and thrown in the brig, where does anybody on the ship get medical care for the rest of the voyage? So you see why this often gets unreported and goes on for a much longer time than it should. It's extremely complex in that unit. I'm going to talk a little bit about moral injury. I prefer to call it spiritual distress when I talk with veterans. There are about 12 accepted definitions of moral injury circulating in the peer-reviewed literature right now. It is a baby concept that just hit the research literature in 2009. So we're just really starting to learn about it as compared to, PTSD we identified in 1980. We know way more about it. So the definition I use are the psychological and behavioral sequelae of experiences that challenge our deeply held moral, spiritual, or values-related beliefs. And that is an amalgamation of Brett Litz 2009 and Jeremy Jinkerson 2016. I have had a bunch of different reactions from veterans to the words moral injury. Have any of you? So what kind of reactions have you seen?
Well, sometimes people really sort of glom onto it, the idea that there is something that, and the reason why my symptoms are not remitting is because it was a harm against like my moral beliefs. And then other folks find it really confusing. It's like, what you saying? Like they don't have any kind of a framework to sort of hang that definition onto.
Right. I have had a lot of veterans tell me that I've similarly had okay, that's it. That is a label for what I'm experiencing. I like that. But I've had other veterans who just absolutely collapse because in the term moral injury, they hear that I've done something wrong and now I'm permanently disabled because I did something wrong. And I've watched these guys just collapse in their chairs. I use this term when I talk to other professionals. I generally don't use this term when I talk with veterans unless they come in using it and that is their preferred term. With veterans, I will often use spiritual distress. If they do not identify as spiritual, I will use values-related distress. For some reason, the word moral seems to carry with it a hint of judgment that values doesn't seem to carry. So just a thing to be aware of when you're talking with veterans about this. Symptoms of moral injury that you might see: loss of belief, struggle or conflict in relationship with a higher power. I have seen people who were special education teachers who worked with autistic adolescents who were some of the most patient people in the world suddenly start biting everybody's heads off with every little thing and coming to me with tears in their eyes going, what happened to me? You know, this is not who I am. This is not what my values are. Why am I acting like this? As in Robert's case, loss of meaning or purpose in life is sometimes the presenting symptom. Reduced trust in others. So there's two different kinds of moral injury. Actually, there's more than two, but the two we'll talk about are internalizing moral injury, in which I lose trust that I myself will act in a socially responsible manner, and externalizing moral injury, in which I'm okay, but I don't trust that anybody around me is going to act in a socially responsible manner. We see fewer of those just because with that value system, how would you actually get to care? With the internalizing folks, we see inappropriate guilt and shame. With the externalizing folks, we see inappropriate anger. So here are some examples of when the rubber hits the road, what kinds of things function as potentially morally injurious events. I have seen far too many, usually female, but not always female veterans who were given the choice between adhering to their sexual morals or being able to protect the lives of other people in the unit. Very significant moral dilemma with that. I bet all of you have already heard about being in a position where you have to kill or injure a child, infant, elderly person, disabled person. Insurgents have actually weaponized moral injury by deliberately putting vulnerable people in harm's way in combat zones. From enlisted personnel, I often hear distrust that command considers their safety or their value to the unit in making decisions and puts them at risk unnecessarily. Flip side of the same coin, I regularly work with people who have been in command who are in the situation of there's only one battle plan that works on this particular issue that we've got, and I know whoever I put in this position in that battle plan is going to die. And I've got to give the orders to make that happen. So moral dilemmas on all sides. From our military medics, I do a lot of work with like the critical care nurses at Wright-Patterson Air Force Base. There's the issue of you can't, mass casualties, you cannot take care of everybody. You feel like you should, you expect, you are trained for this, but you literally can't get to everybody. Another issue that I often see with our military medical personnel is having to care for enemy who like spit at you and bite you and kick you and tear out their own stitches. And at the same time, they are consuming, like if you've got only a few blood products available and you've got to use them with these folks, are there going to be enough left in the next mass casualty situation? If you notice, there's one thing that's pretty common across all of these issues, and that is there is a moral dilemma going on. So we will talk some more about that. So why do we treat moral injury syndrome? It's not even a DSM diagnosis. Why would psychologists concern ourselves with it? Well, primarily because it kills people. Veterans with moral injury syndrome are at in some cases, double the risk for suicide that veterans who are not experiencing spiritual distress or moral injury are. We have studies showing that veterans who have spiritual distress are in treatment for PTSD sometimes 20 years longer than their peers who do not have spiritual distress. So it also, in addition to being potentially fatal, it reduces their ability to benefit from treatment. And then I mentioned the issue of avoidance and how that interferes with treatment and functioning. When somebody does not trust either themselves or others, it's very difficult to enter relationships, and the more they withdraw, the fewer resources we have to take care of them, the less they are likely to come in for therapy. So moral injury is a threat to life and mental health in many different ways, and if we don't pay attention to it, our vets are gonna die. So going from what I see in clinic to theory, there are 4 different kinds of what we call potentially morally injurious events. Doing something that you feel violates your own moral code, witnessing something that you feel is violating a moral code, feeling helpless to address harm, like, for example, the overwhelmed medic, or betrayal, for example, the survivor of military sexual trauma. About 10% who experience one of these will develop moral injury syndrome. So I'm going to talk a little bit about why only 10%? What's going on with that? So moral injury develops in situations where people are living in multiple moral codes at the same time. So for example, for many of us, we grow up with a set of civilian rules, laws, expectations, etc. And we get used to functioning with those, and we learn them when you're 2 years old when you start hearing, don't hit your brother, right? You internalize them at a young age. Then you're deployed to combat, and there's a different set of rules. And you're trained in that set of rules, and you know that set of rules, but the other set of rules is still along for the ride in your head. So you are living in 2 different moral contexts at the same time. Does that piece make sense? If that makes sense, the rest of this is easy. To be able to think about 2 different moral contexts at the same time, in psychospiritual developmental terms, we need to be in stage 4. People in stage 3, which is where the bulk of the adult American population lives, those folks have a concept of this is right and this is wrong. There is no fuzzy space in between right and wrong. It's in the right bucket or it's in the wrong bucket. And if you deal with something in the middle, it's sort of like the foundation of the house falls out. These individuals do not have tools to make sense out of that. On the other hand, when you get to Fowler 4, you can start to look at, wait, there's more than one way to look at this. There's more than one faith group, and they have different beliefs, and there are cultural reasons why those different beliefs make sense in those different cultures. There is a reason why in a military perspective, if I've got a kid who's obviously wearing a suicide vest coming to the checkpoint, and I've held up my hand and I've shouted stop in every language that's in the area, and I've fired a warning shot over their head, and I've fired a warning shot near their feet, and they're still coming, and if they blow up any closer, they're going to take out 100 people. That's a fuzzy gray area. There's a place where we don't kill children, and there's a place where if there are more lives at stake than one, we take one life instead of many. But if you are at a solid Fowler 3, you can't do that. So those folks, you've probably heard this in session, they'll go from one to the other, to the other, to the other, back and forth, and it feels like you're on a hamster wheel. You might make progress, but the next session they come in exactly the same. I see you guys nodding. You've dealt with this. That's a sign that you're working with somebody at Fowler 3. Most of the American population never even hits Fowler 4. So the way out is in some psychospiritual cognitive development that they need a fully mature brain to do. When we look at folks who are in combat, most of them are age 25 or younger, and their brains don't do that. So we've got to be aware of the psychospiritual developmental consequences. We've taken a good solid look at the relationships between psychospiritual development and risk for moral injury over time. So this was a good size sample of veterans with PTSD who had combat experience. And what we found, like the top to bottom parts of this square are conventional Fowler 3 versus post-conventional Fowler 4. The left to right is affiliate, so still affiliated with whatever faith, spiritual belief system, value system they were raised in, versus disaffiliated from that. So one of the things we know from the previous literature is that loss of faith is associated with poorer mental health outcomes. The conventional disaffiliated, so one who basically, this was my faith, and now in this context of the experiences I've had, that doesn't make sense anymore. So, it's all or nothing, good, bad, yes, no, worth having faith in, not worth having faith in. As soon as there's something to question it, rather than grow and explore and figure out a way to make sense out of this, they just leave. These are the folks who are by far at much greater risk for having moral injury syndrome. So this slide are just a few other dimensions of moral injury that I learned about by making mistakes. So I'll tell you so you don't have to make my sense. Effie, did you have your hand up?
Yes, I was just wondering, for the folks that didn't have a previous religious background, would they have a different outcome should they experience that type of trauma? Would they have a similar experience like those that did have some type of religious morals background?
Right. Good question. There's still more to be learned about that because we need to develop more instruments for that. But it does have to do with, do you adhere to the ideals and values that were taught to you as a child, whether they were religious or based on some other ultimate value or valuing system.
To social norms that would.
Exactly. So do they question and run away from those social norms, or do they find a way to make peace with those social norms, even if they have been put in situations with moral dilemmas that require them to violate them or see them violated? Really good question. In terms of the literature on non-religious people, there is a lot to learn. We do know that being religious or spiritual actually is a protective factor in the face of a potentially morally injurious event, but we don't exactly know why, because just knowing that a person is religious or spiritual tells you almost nothing about them. It tells you that they have belief. It doesn't tell you what the content of that belief is. We're working on developing new measures. That's what developing new measures has been the reason we've had a ton of progress in the moral injury literature, but we don't have them to take that apart in that detail yet. So if you want to learn about that, come talk to me and we'll start to figure out some research protocols. So I've talked about, the theory of moral injury I've just described to you is the developmental model of moral injury, or some people call it the psychospiritual developmental model of moral injury. Full disclosure, I developed it, so I had some bias in presenting it. The other model is called the exposure model, which presumes that moral injury works the way PTSD does. If you are exposed to a certain extent, everybody has the limit of the exposure up to moral dilemma that they can deal with and will eventually develop symptoms. I've talked about the internalizing versus externalizing presentations. I'll get a little more as to how those function. The internalizers are very often using self-blame as a way to convince themselves that they had some kind of control over the trauma. It's a terror management strategy. If it's my fault, it's making a deal with the devil. I will hate myself for the rest of my life, but at least I think I can prevent it from happening again.
At least I still have some power.
Right.
The perception of it.
When I'm leading building spiritual strength groups, I often talk about this as the teddy bear stuffed with razor wire. It will temporarily help you to feel better. You keep hugging that thing, you will bleed to death. But one of the things that we need to do therapeutically is get people a safer teddy bear, because you cannot give up a teddy bear if it's the only thing between you and abject terror. Similarly, for those who are externalizers, they cannot take responsibility themselves. They are too fragile to do that. They have to blame everybody else. This is another teddy bear that's stuffed with razor wire. It will eat all of your relationships. So they will also need an alternative teddy bear. The fun thing about building spiritual strength is it is, to my knowledge, the only intervention for moral injury that is designed to work on both. Most of these interventions for moral injury are designed to work on internalizing, which is most of what comes to clinical attention. Another thing to be aware of when you talk with people is realistic guilt versus what chaplains and clergy call sense of guilt. I'm coming to you saying I feel horribly guilty. And then when you ask, what are you feeling guilty about? And they outline, it's like, you didn't do anything wrong. And yet it's hard to get the person to relinquish that guilt because it's the teddy bear stuffed with razor wire. They need another teddy bear. A lot of therapists, etc., when somebody comes to them with moral injury syndrome and they say, yes, I feel guilty because I killed a child, they just like sign on, okay, you killed a child, you did something wrong. It's like, wait, in what context did you kill a child? Don't be suckered into the client's pathology. So find out about context.
I have a quick question about that.
Yeah.
I know in CPT there's like a section looking at someone who's doing it actively right now, responsibility versus guilt, and like sorting that out. How do we sort that out similarly in this?
So here's the fun thing. Yes, sorting moral injury out on a cognitive basis, if that works, do it. And that does help some people. A lot of therapists who come to me for help with moral injury are hitting a wall because they've reached a case of moral injury that does not respond to cognitive interventions. And that's kind of the classic moral injury, because that's about, I need a new teddy bear. I need to like revise my value system so that I have value despite what has happened. And so for those folks, you can do cognitive therapy all day long and you will feel like you are running on a hamster wheel, and both you and your client will want to pound your head against the wall. That's where you need to get into. If you're good enough at cognitive therapy that you can get to the basic assumptions, you might be able to get there, but sometimes you've just got to go with some other approach like a psychodynamic or a narrative to get this done. And we can talk some about that today, and we can talk more about that. There'll be other trainings available on this to help you with the idea. I'll give you a really quick example because we have only so much time left. Quick example of this is I had a veteran who told me he could no longer pray. This was somebody who went to seminary. I mean, he was tight with his higher power. Like, why can't you pray? Well, because 18 years ago I cussed out God and I'm quite sure he wants nothing to do with me. Why'd you cuss out God? My 18-year-old son died in gang violence and my pastor told me God took him because God needed him more than I did. All clergy immediately go, ew, when they hear that. One of the members of the group told him, God would never take somebody you love from you deliberately. The only spiritual force that would take somebody you loved from you would be Satan. That thing you cussed out was Satan. That affirms how much you love God, that you would cuss out Satan with every fiber of your being like that. That kind of cognitive therapy can work because we are returning the teddy bear. But you've got to be aware of that dynamic, and you've got to go at big, deep assumptions that he was never bringing up the assumption of was that thing he cussed out God. Does that get to your question? All right. We're going to need to go through the research quickly because I've been going too slow. Sorry. Why did we develop building spiritual strength? Quite frankly, it was because my colleagues and I saw that, first of all, Most veterans who needed first-line treatments for PTSD wouldn't use them. Many of them wouldn't even come to the clinic and didn't want to talk to a mental health provider. They'd rather talk to a chaplain. The other reason was we were seeing a lot of places where sometimes faith was being used to support recovery and sometimes faith was being used as an avoidance strategy. We started the bench research that preceded building spiritual strength because we couldn't figure out what made the difference between the two or how to respond therapeutically. These are things we've already talked about, so in the interest of time, I'm going to go on. A pilot study for building spiritual strength, 56 veterans, wait list control. I like wait list controls because not only do you get to compare the active group to the wait list, but you also get to control the wait list's performance in active therapy to what they were doing while they were on the wait list. So you get 2 studies for the price of 1. What we saw in the first pilot study was an improvement in PTSD and depression, and improvements in positive religious coping. One thing that I thought was especially exciting was that our minority race veterans signed up at well above baseline levels for the area in which we were recruiting, and they benefited more than Caucasian veterans. So I'm like, oh, something we can do about mental health disparities. Let's learn more about this. Second study was much better funded, much bigger sample. This time, like first study, we used psychologists as interventionists. This study, we used chaplains as interventionists. I will not, unless you tell me you're really, really big into research methodology, I'm going to skip this slide because we're running low on time. From this slide, this is our sample description and our consort chart about how we had attrition and who stayed in the study, etc. I think the high point of this slide is take a look at the amount of spiritual diversity we've got. I mean, yes, most of the participants are Judeo-Christian, specifically Christian, but we had lots of people who were agnostic, spiritual but not religious, Sufi, Jewish, etc. We asked everybody qualitatively at the end of the study, did you feel like this was appropriate for your spiritual beliefs? Nobody disagreed. So we were able to, in good public health practice, reach across faiths and non-faiths quickly and easily. PTSD symptoms, our control group was present-centered group therapy. We were basically, present-centered group therapy is an evidence-based treatment for PTSD. Building spiritual strength did every bit as well as present-centered group therapy in treating PTSD symptoms. When we looked at spiritual distress, so we used the measure of spiritual distress with 6 different subscales. The first subscale is the one with the largest eigenvalue. It basically subsumes most of the variance in spiritual distress that's on this instrument, and it's called divine distress. So it's in this top left-hand box over here. That's distress that occurs in the relationship with the higher power. For example, Robert's belief that the higher power was a disappointed drill sergeant who now hated him. So people in present-centered group therapy, that's the red line, they started with a very high level of spiritual distress. I'm sorry, present-centered group therapy is the blue line. They started with levels of spiritual distress. By end of treatment, that had gone up a little bit. And by 2-month follow-up, that had gone up a lot, which causes me to wonder in our fully secular treatments for PTSD, when we are not dealing with spiritual issues, which was the requirement in the control group, are we making things worse? This is a risk factor for suicide, this subscale, and we're potentially making it worse in secular therapy. On the other hand, the Building Spiritual Strength group, we would see from the beginning of BSS to the end on the red line, a dramatic drop in divine distress. And at 2-month follow-up, it's still dropping because we taught them some skills and some journal techniques that they could use to continue to bring it under control. This was a big effect size. So we did as well as the evidence-based therapy for PTSD in PTSD symptoms, but much better than the evidence-based therapy for PTSD and resolving spiritual distress, which was the closest thing we had to an ability to measure moral injury syndrome back in 2013 when we did this. So this is what the divine distress scale, these are the items on it. And there are important correlates of the divine distress scale that when you look at them all together kind of look like the component symptoms of moral injury: depression, anxiety, anger, loneliness, and problems with meaning in life and life satisfaction. So this is really strong evidence for the usefulness of building spiritual strength. So I think I've covered all of these points. And here are the references, and I'm going to take this off the screen now so we can have discussion. Okay, so for people out there in TV land, oh, I cannot turn this laptop so that they can see anybody but me, so I'm just going to take our camera off. All right, questions, thoughts, concerns, anything I said that was stupid, please tell me about this.
I'm wondering if there's been any research surrounding kind of if people hold specific values, if they're more likely to experience moral injury. Like I was thinking about if someone has a really strong sense of justice and that's really important to them, this sense of like fair, right, and wrong, and getting justice. Like I've seen that with several veterans, that is a really highly held value for them. I wonder if that would correlate with maybe experiencing more moral injury because there's somewhat maybe rigidity or...
Right. So to put what you're saying in terms of the context of the research, think about there is a developmental stage at which children become really fixated with fair. And about what age is that?
First grade. 5, 6, 7.
Yeah, by 8 years old, every kid should be starting to get preoccupied with that. So that is sort of a textbook when we enter Fowler 3. And so it is developmentally normal. Libby, disagree with me if you know your way around, or Terry, you also disagree with me because you guys probably know your way around Fowler even better than I do. But it would be really normative for somebody who's at Fowler 3 who experiences their world in right and wrong buckets. Okay, I have turned off my sharing.
She might be talking about your camera. Our camera is not on for here.
Right, so here's the issue. I can't hook into that camera, at least I don't know how to hook into the camera. So I apologize. Okay, thank you. So that's a developmental issue rather than a specific value issue. Does that make sense? Okay. Other thoughts? And I will try to keep my beady little eyes on the chat to see if there are questions coming in on the chat too. Other thoughts, ideas, concerns, experiences with veterans managing this?
This is really helpful and just a nice affirmation of the vet that I have sent to you for group. I think that he will benefit from this quite a bit.
Okay. All right, well, thank you. And we are being recorded, so we can't talk about vets. But if anybody wants to get in touch with me, both for the people out there in virtual land, and I see that BG has a hand up. Was that because you wanted to ask me to deal with sharing, or did you have another question?
I had a question.
Go for it.
Okay, this is Buffy. And I just wanted to say that I was struck by the comment that you made about 40% of veterans having trauma or PTSD exposure prior to enlistment. And I just wanted to hear more about that overlap and the vulnerability that maybe exists. Because I'm just sort of thinking about, like, for example, you just mentioned that something could be a developmental issue. So if somebody had trauma as a child and then they enlist and now they're obviously developmentally that more of an adult, how does that overlap or show up or impact or rub against one another? Can you speak anything to that point?
Sure. So there may be people here who are better developmental psychologists than I am, because the work I've done in development has been in adult psychospiritual development. But I do know that 40% of the veterans that we now have in our military have a history of adverse childhood experiences before they come to the military. There are lots of possibilities for how that can play out, none of which I can speak to on an empirical basis. But I do think if you were in a family that was not functioning well, and you wanted, upon turning 18, the heck out of that particular family, what is the fastest, easiest way to have stable housing and stable income and a forward-moving career away from that family?
Enlistment.
Yeah, for many people, that is a way out. So that overlaps with a lot of different things. It can also overlap in addition to adverse childhood experience, how well or poorly a family is functioning, what resources the individual has. But essentially, our military there are many reasons that people enlist, but it can become sort of a catchment for people who lack resources and have been through multiple traumas. If the trauma impacts cognitive development, and I've seen varying research on what kinds of trauma might impact development and what kinds of trauma might not. There is both resilience and deficit in the literature, sometimes at the same time. But if somebody has a history of trauma that affect cognitive development or normative adult development, yeah, then they've got multiple risk factors. I'm not sure that I'm telling you anything you don't know, Buffy. Do you want to comment on this or add your perspectives?
Irene, I'm glad you can't see me because I'm bobbing my head over here and I'm saying, oh my gosh. I mean, yes, but it's really nice that you so succinctly state it because yeah, so helpful, so helpful. And I think when we think about this as providers to help other people to unpack it as just super objective versus, like you said, no, you didn't curse God, you were cursing the devil. Like something as simple as that, just shifting the point of view that you're standing on is, oh, awesome. Thank you. So no, that was super helpful.
Okay, so that brings me to a point I do want to make before we get done. We are going to be offering a full day free online workshop in how to become a building spiritual strength provider. The primary technique by which BSS is effective is that push from Fowler 3 to Fowler 4. And what we do every single session is ask people to process things by more than one perspective at the same time, over and over, different ways, session after session. But ideally, what we expect to happen is somebody has to look at issues multiple ways over and over. By the time they get done with this 8-week, 90-minute session intervention, they will at least be at an approach to Fowler 4. And most of them are at, if they're not completely resolved with their moral injury, they are usually well on the way. What I see from folks who are not resolved in BSS, there is either an axis 2 disorder like narcissism, or the issue for which they are referred isn't actually moral injury. Like it might be pathological guilt, but is not pathological guilt driven by moral dilemma. It's pathological guilt driven by, for example, chronic depression. Does that make sense? Maybe not, because nobody's reacting. Okay, I'm seeing some head nods. So anyway, if you want to learn more about how to help veterans flip the perspectives that are hurting them, come to our Building Spiritual Strength training. That will be on October 25th. It is all day. The trainers, I have to be at a different conference that day, but the people who are leading it are Chaplain Tim Ussett, who is the only person in the world who has done as many or more BSS groups than I have, and Dr. Susanna Kondrath, who is also one of our BSS trainers around the country. They're both great. Most people really like this training. So I encourage you, if you want to learn more about this and how it works, please make the October 25th training. And Anna, you are on. You're going to be sending out an email if you haven't already about that training?
Yes, that has gone out, but it can go out again as well.
Okay, yeah, maybe if you follow this session with a, in case you were interested, email, so that people can make that training, because we will go into much greater detail about how moral injury develops and how we can bring people out of it in that training. We can also tell you more about the other evidence-based interventions for moral injury. There are literally hundreds of interventions for moral injury out there. That said, there are only, to my knowledge, about 6 that have an evidence base behind them, which actually scares me a lot. But we will let you know not only about BSS, but something about the other interventions and how they work as well. We are running low on time. Jen, are there other things that we want to make sure we talk about for housekeeping before we go? Okay. All right, then I'm going to bring us to a close simply because I bet a lot of people have clients at 11 and you got to go get ready to take care of them. Thank you, everybody. Have a great day. Text me or email me if you want to ask a follow-up question we didn't get to. Thank you, everybody, for being here.